This entire half hour, we're focused on your coronavirus questions. So often we're asked, when will the restrictions and social distancing end? The governor has said more testing is an important part of easing the restrictions. Tonight, Pat Doris starts us off by answering, do we have enough tests?
It's been fascinating looking into the testing for COVID-19 in Oregon because it has really flipped just in the last couple of weeks. Used to be impossible almost to get a test. Now there are thousands, about 8,000 in fact, sitting on the shelves each week going unused. 8,000 more people a week could get tested if they wanted to. When I ask the doctors why that's not happening, they think it's two reasons. One, people have heard so many times that it's hard to get a test, and so a lot of folks are just not trying, they think. And then number two, there's just not that many people on a daily basis that come down with a serious respiratory illness so that they say, I don't care how hard it is, I'm going to go find out. But the governor has said we need about 15,000 tests a week, the capacity for that, to start thinking about reopening the economy. There's a lot of boxes to check, but that's definitely one of them. If that's the bar, check that box because we have way more than 15,000 tests a week for COVID-19 in Oregon.
All right, thanks, Pat. Now, many of you are asking us whether all of this social distancing is cutting down on other contagious illnesses, things like the flu. For that and other answers, let's turn to our live guest, Dr. Claire Wheeler, a public health specialist with PSU and OHSU. Dr. Wheeler, has the caution that we've been taking with coronavirus had an impact on the number of flu cases?
Well, if the timing had been right, then yes, that would have been the case. But COVID really started taking off just as the flu season was ending. So we were coming down the curve that we have every year with flu. And just as we were on the downside of that, we started going up the curve with COVID-19. In fact, this last flu season that we had, the 1920 flu season, was one of the worst ever, and one of the worst in the last at least 20 years or so. And it was the worst ever in CDC recording history of hospitalizations in little children and adults up to the age of 45. So we actually were coming off of a pretty severe, pretty much the second worst flu season that we've had in the last few years, and right into the COVID crisis. So maybe if they had overlapped more, our distancing measures would have reduced the impact of flu, but it just didn't work out that way.
All right, so this next question comes from one of our viewers, Joanne. She asks, my husband and I have observed very strict distancing guidelines, having food delivered, cleaning packages and mail, etc., for about 30 days. My daughter and husband and young child have been doing the same. Isn't it safe for us to get together now that we're sure we don't have the virus? Is that true?
You know, any reasonable person, I think, could hear that story and say, yes, that sounds pretty reasonable for you to spend time together, assuming that you have been 100% diligent about, social distancing. But then my question when I read this was, well, are they planning to just start visiting, going back and forth on a regular basis? I would not advise that. Are they talking about hunkering down together and continuing through the next few weeks together? That would be great. I just feel wary about advising people to just start coming and going because it's pretty easy for our precautions to break down in that situation. But also, families need to be together. And if they really are confident that they've done the best they can to get through a quarantine period, then I say, go ahead and spend some time together.
A really good point there. And so this is another one that we've been hearing a lot. What would it take to start actually clearing people to go back to work? Would it be an antibody test, coronavirus test, temperature scans? How do you see that working?
Yeah, see, this is the thing about testing, because we keep talking about testing, but we're not specifying what type of testing we're discussing. For example, we just heard that we have these thousands of test kits here in Oregon. Those, I'm pretty sure, are tests to diagnose whether or not you have the virus in your body. The nasal swab test, that is that's the test for the virus. That's basically a diagnostic test where I can just see whether or not I'm a carrier or whether or not I'm infected. The testing that we need to go out and reopen everything and go back to life to some semblance of what we call normal, we need antibody tests. An antibody test will tell us whether or not I have an active infection or I am immune to this virus, and that's what we're looking for. We need a level of immunity in our community, herd immunity, that is quite high, in order for us all to feel confident about just going out there. And in order to assess whether or not we have adequate herd immunity in our community, we need those antibody tests. And that's a blood test, not the nasal swab test. So this is for diagnosing whether or not you have the virus. The antibody tests are going to be part of the next phase when we're trying to get people back out into the world again. And we need to know whether or not they're immune to this virus.
And there's one final question I really want to know too, is that we've been hearing a lot about treatments, things like that. And we want to know, are there any promising treatments that we're seeing out there emerging for these seriously ill coronavirus patients, specifically those antiviral drugs?
Yes. Well, you know, for the people who are really sick with coronavirus, there's a lot more to their treatment than just medication. Critical care medicine is a very complicated process where there are other techniques like ventilation, proning, moving people under their bellies, and other things that need to be done. But pharmacologically speaking, it looks promising to perhaps consider combining an antiviral with some type of inflammation suppressant. So an interleukin-6 suppressant medication would be one option, and the one antiviral, and I want to make sure that I get the pronunciation just right, is remdesivir. That's the one that is the most promising in clinical use in China, but we need clinical tests. We need to actually see whether it's better than a placebo. So there are promising treatments on the horizon. They're not all pharmacological, and we don't really have anything that we can just tell people, healthy people like you and myself, to just start taking as prophylaxis. The quinolone drugs appear to have a lot of cardiovascular complications, so that is not something that people should just start taking to try to avoid getting sick with this.
Yeah, really important to keep side effects and things like that in mind. Well, thank you so
Absolutely.
much, Dr. Wheeler. We really appreciate you answering our questions and taking some time for us.
My pleasure. Thank you.
And at any time, you can send in your questions. The number is right there on your screen, 503-226-5111. We'll be answering questions right here at 7 o'clock, Monday through Thursday. Up next, what's being done to fix the process of applying for unemployment? But first, you wanted to know if you can still use public transit during this pandemic. The answer, yes, but TriMet is limiting how many people are allowed on buses. Service is temporarily reduced. TriMet is asking you to stay off public transit unless you're heading to or from an essential job or you're traveling to the grocery store or pharmacy. A record number of Oregonians have filed for unemployment benefits, and we're still hearing from people having trouble with that system. There was a computer problem over the weekend that's been fixed, but a lot of people say they still can't get through to anyone on the phone. So what's being done? Lindsay Nadrich looked into it.
Molly Burhop was laid off at the end of March. She's repeatedly tried to file a claim online, but says it keeps getting denied and she doesn't know why. But when she calls,
can't get through on either. They just ring and ring and ring, and the local one usually just says the circuits are busy. And you can try it all day long. Hundreds of calls. I mean, it's just every day.
After talking to multiple people like that who cannot get through to anyone, I wanted to try the number myself, so let's call it. It's a busy signal. That's what happened when I called about an hour ago. Let's try it one more time. Busy again. So this is the number they told me to call for an unemployment claim. Still can't get through to anyone. The employment department said they know getting through by phone has been difficult, but said once someone gets through, they will still get benefits for the weeks they weren't able to file. They said people can also try emailing. OED_COVID-19_info at Oregon.gov for help. They also hired hundreds of people to take claims and are adding more this week.
Well, if you're in need of a color or a cut, you're likely wondering when our hair salons will reopen. Stylists in Oregon have a petition asking to be back to work a week from today. More than 34,000 people have signed the petition, which aims for salons in the state to begin to accept clients one at a time. An independent stylist who works out of Malva House of Hair wants to get back to work, but she also wants to make sure clients and stylists are safe.
What kind of measures will we have to take to allow clients back into the salon, and what kind of protective equipment we might need, like masks and gloves. Like, I just would like to know like what it's going to look like, or at least start talking about it.
And right now, the petition doesn't give those answers. So I reached out to Governor Brown's office asking if she'll allow salons to reopen next week like the petition suggests. And it looks like you may have to hold off on an appointment. Her office responded with a statement that reads in part, the governor says ultimately health outcomes will be the metric guiding decisions to reopen. And we will only reopen Oregon if the data shows we can do so without jeopardizing public health. Are millionaires getting million-dollar stimulus checks? That's the claim spreading online. So is it true? Jason Puckett of our Verify team investigates.
Millions of Americans started seeing stimulus checks deposited this week, but a lot of posts and even articles are talking about a bigger stimulus payment for wealthy Americans. Tweets like this one from actor Don Cheadle claim 43,000 millionaires will get an average $1.6 million from the stimulus bill. So we're verifying, is this true, and how would that be possible? Our sources here, the CARES Act itself, along with data from the Joint Committee on Taxation, a nonpartisan body of Congress. There are two parts of the bill that people point to. On page 193 of the CARES Act, there's a, quote, modification for net operating losses. And then on page 205, there's the, quote, modification of credit for prior year. Combined, these two sections of the bill change tax law in 2020. They let a certain type of business owner, like real estate investors, for instance, use their financial losses in recent years to lower the amount of taxes they will owe in 2020. Basically, qualifying people will pay less on their taxes in 2020. Now, the Joint Committee on Taxation, or JCT, explains the reasoning a bit. People are expected to lose a lot of money in 2020 because of COVID-19. These tax cuts would, in theory, help them keep more money and offset the loss. But the changes affect some groups more than others. The JCT sent this letter to Senator Sheldon Whitehouse and Representative Lloyd Doggett last week. It breaks down who gets these cuts and how much. This will affect people in all income brackets, but the largest group is those making more than $1 million each year. The JCT estimates that about 43,000 people with more than $1 million in income will see a combined $70.3 billion tax break in 2020. Now that averages to about $1.6 million per person. So yeah, we can verify these claims are correct. Changes to the tax law in the CARES Act are estimated to lower taxes for about 43,000 people who make $1 million or more in income. And the total averages out to about $1.6 million per person. A few important notes: this isn't a lump check or payment, just a reduction of taxes in 2020. And a reminder that these are just estimates. It's possible they could change if the pandemic's effects on the economy also change. Folks, if you got other questions for us to check out, send us an email. With your Verify, I'm Jason Puckett.
Up next, who is Dr. Fauci, and how did he land the job of one of the top doctors in the country? We'll share his story next. But first, you wanted to know, do you have to pay a tax filing company in order to get that stimulus check? The answer, no. You do not have to pay anyone in order to get your check. Head to irs.gov and click Get My Payment to track your check.
Dr. Anthony Fauci, a key member of the White House coronavirus task force, has become a household name and the internet's new crush. Known for his ability to break down the science behind the disease for a wide audience, he is viewed as the most trusted voice by both Democrats and Republicans. So who is Dr. Fauci? Fauci was born on Christmas Eve in 1940 to Italian immigrant parents in New York. When he was a child, Fauci worked in a family-owned drugstore. At 5'7", Fauci was captain of his high school basketball team. He received his medical degree from Cornell University Medical College, where he graduated first in his class in 1966. Fauci started his long career at the National Institutes of Health in 1968. Over the next 5 decades, he steadily climbed up the ladder to become the nation's leading expert on infectious disease. In 1984, he became the director of the National Institute of Allergy and Infectious Diseases, a position he still holds today. During his tenure, Fauci has served 6 presidents and worked to battle AIDS, SARS, Ebola, Zika, and the coronavirus. Fauci first stepped into the public eye during the AIDS epidemic in the late 1980s. As the LGBTQ community became increasingly frustrated by government inaction and public apathy, Fauci, then a government spokesperson, became a target of activists. However, when protesters stormed the NIH building, Fauci surprised everyone by inviting them into his office. He ended up working with activists and adopted their idea of parallel track, an approach that expanded access to promising new drugs.
I consider Fauci one of the great heroes.
Now, with 3 decades of experience combating infectious diseases, Fauci has become the one person the public turns to for fact-based analyses during this pandemic. He has also been a blunt voice.
It is a failing. I mean, let's admit it. Things will get worse before they get better.
Occasionally contradicting the president.
The evidence that you're talking about, John, is anecdotal evidence.
When asked how he managed to not get fired, Fauci said, even though we disagree on some things, he listens.
The idea of just pitting one against the other is just not helpful.
At 79, Fauci is known to be a workaholic even by Washington standards. He used to run 7 miles a day, but had to cut it down to 3.5 miles during the epidemic. When asked about the recent threats he's received, Fauci simply said, "You know, it's my job. This is the life I've chosen, and I'm doing it."
Wow. All right, well, coming up next, what help is available for those helping others? A local therapist offering services to frontline workers. But first, you wanted to know, will the stimulus check be taxed? The answer, no. The CARES Act made this money available as a federal income tax refund, and the IRS shows that refunds are not taxable. This has been a stressful time, especially for healthcare workers. What's being done to help them mentally? Well, a licensed therapist in Vancouver offers some online counseling.
It doesn't mean that they have a problem or that there's something wrong with them if they seek out therapy or counseling services. I think that's the biggest thing that I want to get across. Like, we're here to help and we're here to support. We know that there's a need there. And I just want healthcare workers and first responders to know, like, you don't have to be so stoic about this. You don't have to soldier through this situation. That, like, we're going to get through it together, and that means we have to do it together.
And you can find more at virtualtherapytoday.com. And while we talk about mental wellness, it's important to consider how to ask, how can I cope with the situation? Dr. John Torres tells us the first steps to take.
You know, the first step to take, if you're having a hard time and it's actually interfering with your daily activities, if you're having thoughts of suicide or thoughts of hurting yourself or somebody else, then definitely seek help at that point. That's a medical emergency. But if you're starting to get a little blue, a little cabin fever, then start thinking about what's going to happen over the next few months, things that are going to open up, the things we're going to be able to do once we start opening up more things and can do more things. But on top of that, try and make connections, because isolation is really hard on us, both physically and mentally. So connect with people that you haven't talked to in a while, whether it's through social media, whether it's through even just picking up a phone and making a phone call. It's important to make sure that you reach out to other people, even though you're in a room, you're by yourself. Social isolation doesn't mean social disengagement. It basically means physically keeping away, but not mentally having to.
Thank you so much for joining us tonight. KGW is committed to continuing coverage on the coronavirus outbreak. If you still have questions, our past stories might answer them for you. You can go straight to kgw.com/answers to see all of our past Q&As.